Talking about the vaccine, so where we are with our vaccination, well, we're doing a fantastic job with vaccination. We've really ramped up our capacity to deliver vaccines to Mississippians. We've seen great success through our drive-through sites, and we've seen increased activity through our partners and their ability to get vaccine out. So you can see, if you look at the New York Times and other places, that we've catapulted really pretty rapidly in the rankings as far as getting the vaccine out. We do have a challenge, though. If you consider who all is eligible for vaccines, those who are healthcare workers or those who are over 65 or 16 and above with chronic medical conditions, that does comprise a large part of our population, about 1.3 to 1.4 million people. That's a lot of people in Mississippi that now qualify. But if you look at how much vaccine that we're allocated, right now we get a steady stream of about 37,000 first doses coming into the state every week. And when we get those allocations, when we get those doses available to us, we order them right away and they're sent off to different locations so they can be administered. So we don't really have like a stockpile of vaccine. We're using it real time, almost like a real time inventory. And then earlier in the week, we get an allocation of our second doses, which is a separate release. So as we think about this, I think there's several key points we need to consider. First off, there are a lot of people eligible in Mississippi, but there aren't that many vaccines coming in on a regular basis. So we'll need to be patient, but also diligent to make sure that we protect the vulnerable people in Mississippi as quickly as possible. The other thing about that is to understand that the second doses come as a separate allocation that is predetermined. And so if you had a first dose, there is a planned allocation in the future for you to get your second dose. And so we have every expectation that that's going to occur as we step off into the future. With the second doses, we know it's been a challenge for some folks to get their second dose appointments through the online portal or through the call center. And there's a very good reason for that. The logistics of making sure that we have the proper second dose in the right location for each person, it's an absolute logistic monster. But we're working through that, and we have taken steps to make sure that we're going to have more and more availability and visibility on when the second appointments can be made. We did open up about 12,000 additional appointments for second doses. So appointments for second doses going through mid-February. So if you are eligible for your second dose in the month of February and you don't have your appointment yet, please go on and schedule your second dose now or as soon as possible to make sure that we can get you that dose. The other thing is we will be opening up additional appointments throughout the month of February as we have additional visibility on where we are going to have our drive-through locations and also what vaccine availability we're likely to have in each location. So please rest assured that there will be that availability as we go into the future. Going back to the 37,000 a week distribution that we get, our visibility of that doesn't really occur until they're immediately available. And so we were made aware today that we had 37,000 that we can order for the next week. And what will happen is we have those available. We will identify the locations where those need to go. 30,000 of those routinely are going to go to our drive-through sites because that's where we're doing the vast amount of our throughput. The remainder will be shared with partners, especially partners in areas where we don't have drive-through sites. We want to make sure that we address both geographic disparities, but also racial and ethnic disparities. And so we do spend a lot of activity working with partners and identifying locations where we can get that vaccine out, not only to partners who can meet the need because that's their mission, but partners who have a proven track record because we got to get this vaccine out and into people as quickly as possible so that we can maximally protect our populations. We do have some great partners out there and we continue to work with them. Many of them are going to be small clinics, some affiliated with bigger systems, some not. And we've had a great relationship with our community health centers, also called our federally qualified health centers, to make sure that we can get vaccine out to those who are most vulnerable for a whole host of reasons. So that's really all I have for my bit of the update. I hope that helps clarify the process a little bit and understand that, when we have an appointment, we're building appointments based on anticipated delivery, and we have every expectation that we will have vaccines for additional first doses in future weeks, and anticipate seeing additional appointments being available, and also that for second doses, those should be already covered. So with that, I'll go ahead and turn it over to Dr. Byers, who can give us an update on the epidemiology of COVID in Mississippi.
Thank you, Dr. Dobbs. Yeah, just to let y'all know that when we look at our indicators over the last couple of weeks, it looks like we are starting to see some flattening of the rapid rise in the number of cases that we've seen so far at the end of last year going into the early part of this year. Even though, with that being said, we are reporting out more than 2,000 additional cases today, 2,290 cases, and along with that, 30 deaths. But if you look at our EpiCurve, certainly we put those on our website, you can see that it looks like there's a bit of flattening in the rise in both deaths and in the number of cases, and perhaps even a little bit of a downward trend in the overall number of cases that we're seeing, although it's too early to say if that's really going to be a long-term trend. We are still seeing a large impact on our long-term care facilities. When you look at our overall state cases, so far since we began this pandemic and reported our first case now back in March of 2020, we've had almost 260,000 reported cases in the state. And among those, we've had 5,668 deaths. And a good number of those have been in long-term care facilities, more than 1,800 of those deaths. And so, we have continued to see a pretty significant impact in long-term care facilities. That has improved, but we still have over 150 nursing homes that have ongoing active outbreaks even as we speak. And that's why, the efforts to continue to vaccinate those residents and staff in long-term care facilities is so vital right now, because that's going to be a huge win for us when we are able to complete that. If we look at the target groups, and Dr. Dobbs had mentioned that, for those folks that are eligible now for vaccine, that does encompass a very large proportion of Mississippians. When you look at those folks, especially 65 and older, and the impact that we've seen on them so far, more than 75% of the total deaths that we've had associated with COVID in Mississippi have been in individuals 65 and older. And that's why that is so important for those individuals to get vaccinated now. And that's why, we're so grateful that we have the opportunity to really work on this and make it happen. We are starting to see some improvement in our hospitalizations related to COVID. We have had some decreases in the number of confirmed admissions due to COVID, and that's dropped down to 1,100 now, 1,149. We've seen some improvement in the number of COVID-related patients that have had to be in the ICU or on the ventilator. It's still a little bit up and down right now, but certainly when we look at the beginning of the year and toward the end of last year, we have had some significant improvement in that. And we hope that continues. And just remember that when we see increases in cases now, those cases that are occurring now translate into those hospitalizations later. And we're looking at somewhere around 7 to 8%, maybe a little bit higher, of our total cases requiring hospitalization. And so we know that, the 2,200 cases that we see now, eventually we're going to see about 8 or 10% of those potentially hospitalized down the road. So that's where we stand, cautiously improving, but we are not out of the woods yet. We still have a lot of work to do. And I continue to encourage people, not only if you fall into those eligibility groups, to work to get vaccinated at one of our drive-through clinics, but also continue to wear a mask, continue to social distance, continue to avoid those group settings where we know that transmission can occur. And I'm going to turn it over to Mr. Craig to talk about the wonderful work that his team and other folks within the agency and our partners outside of the agency have been doing with those drive-through clinics. Jim?
Yeah, thank you, Dr. Byers. And Yeah, we have had a great partnership with our friends at the Mississippi National Guard, local law enforcement, state law enforcement, EMS agencies, hospitals, lots of folks working together to make sure that we provide some vaccination opportunities here in Mississippi. Liz announced that we had 18 drive-through sites, and as you know, we have been operating 18 sites now for 3 weeks. This is our third week of operating these sites around the state of Mississippi. But today, although a pretty rainy day here in Jackson, we opened our 19th facility. That was at Smith-Wills Stadium. It opened up this morning at 9 o'clock. Even besides the rain, it was welcome to see a lot of Mississippians who had appointments coming in to get their shots. Probably about an hour and a half after we got that operation started, the line was moving to our system standard, which is about a 30-minute encounter from the time that you say hi to us at our greeter station and you say so long to us at the end of your 15-minute observation period. So as a key part about these sites is that these are vaccination-only sites, which means you must have an appointment for a vaccination at a vaccination site to receive a vaccination with us. So if you make that through the hotline or you make that online at covidvaccine.umc.edu, any of those ways to get that appointment, you have to have that appointment to come to the site and receive your vaccine. Looks like right now we're getting about 6,000 appointments a day in each of these locations. So that's about 6,000 opportunities per day, Monday through Friday for the mass vaccination sites that we have. So just a little update on that. Just want to make sure everybody understands that it is a great opportunity and it's a great partnership working to deliver this service in the state of Mississippi. But it's very, very important that people understand that this is that these sites do require an appointment to receive your vaccination before you come to the site. Anyone who comes to the site that doesn't have a vaccination appointment, we'll help you try to find out some of the times maybe and ways that you can get that appointment. But we cannot service anyone on the sites that do not have an appointment. So it's very, very important that they have that appointment before they come out.
Thank you so much, Jim. We appreciate that update. We're going to go to questions now. And we have the first question from Jill with Bloomberg News. Hi there. Thanks for doing this. Sending a question early since you mentioned shipments. Moderna has reported delays in vaccine deliveries because of an issue with McKesson gel packets that got too cold in transit. I'm wondering if shipments to Mississippi as part of your weekly allocation, either this past Monday or upcoming Monday, are affected by this issue. Dr. Dobbs, do you want to first address this?
You know, we haven't seen any issues so far. I mean, certainly something we're monitoring and have been in communications with our immunization staff, but to date, we do not appear to have been impacted by it.
Okay, thank you, Dr. Dobbs. From Ronnie Mott, does the 37,000 allotment include doses for long-term care facilities? Paul, go ahead and take that. Dr. Byers? Okay, are you?
It does.
Sorry, I got, it took me a second to unmute. Apologies. No, it doesn't. Thank you, Dr. Dobbs. No, it does not. That allocation method for the CVS and Walgreens federal partnership comes in a different way. And so this 37,000 represents those doses that are available directly to Mississippi for us either to utilize with external partners or through our drive-through clinics.
Okay, thank you, Paul. Courtney Ann Jackson, WLBT. It is my understanding that MSDH is going to partner with the Lawrence County Hospital on a drive-through site in that county. Is that model of partnering with local hospitals one that you plan to utilize more moving forward? Jim Craig?
Yeah, and that is true. I met with officials in Lawrence County, including hospital officials this week to look at some of their planned activities around their pandemic planning. You know, in the state of Mississippi, county governments, hospitals, and the health department and others have been doing pandemic planning for a decade. So there are some pretty good plans that are already in place. Lawrence County had some of those planned activities for when they have enough vaccine available to be able to receive a vaccine in their community to deliver that vaccine. So we're definitely working with them to see if we can increase some of the geography of where Mississippians can get those shots.
All right, thank you, Jim. Shalina from NPR, we are seeing a slow uptake in vaccine by healthcare workers. Is the state seeing more hesitancy among Black healthcare workers, and what is being done to reduce the fear of taking the vaccine? Dr. Dobbs.
Yeah, so we don't have a precise awareness of the degree of it, except for the fact that early on, our initial statistics showed that around 17% of African Americans were receiving the vaccine. As far as like, you mean like of the total number, and even when it was only healthcare, that number was only 17%. So, and we know that Black folks make up about 38% of the population. So we have seen some reluctance early on. So but we've seen a little bit of a trend that's been different. We've seen after people have seen their friends and colleagues and leaders, especially leaders in the Black community, Black physicians showing faith in the vaccine, and a lot of guys that you've seen our work with Dr. Phillips and Dr. Sullivan and Dr. Quinn and Dr. Turner and all these guys to show our faith in the vaccine. That's really helped. So we'll continue to do those things. We met with some leaders of some of our historically Black colleges and universities yesterday and vaccinated some folks who are eligible within their ranks. It's going to be a steady approach to try to make sure we reach folks without maybe some hesitancy, or maybe also because of other barriers to access. And so we see two real challenges. One of them is going to be trust, and one of them is going to be availability, and we're going to try to tackle those simultaneously.
Thank you, Dr. Dobbs. And this is kind of segueing to this question. This is from Alex with Mississippi Today. Can you talk about specific steps that the state is already taking or considering to help reduce the racial disparity in who receives vaccines? Dr. Dobbs, go ahead.
Yeah, so I can tell you what we've done so far, and a lot of it's is building trust through leadership. And if we know who do people trust within the Black community, it's going to be some of their political leaders, some of their preachers, right, pastors, and physicians. And we know that those are strong groups, and we've been working closely with those guys. I do have a meeting tonight with some of the Black pastors, trying to make sure that we can get better messages out. And so, building trust that way is one way to do it for sure. And that's just sort of like a tip of the iceberg sort of thing. And then access is the other issue. What we've heard over and over again is a lot of Black folks want to get it from their doctor, or they want to get it from their local clinic because that's where the trust is. And so that's one of the reasons why the community health center cooperation has been so helpful, because we know that they do really service not only people who are primarily of color, but maybe people who maybe have other access issues that maybe won't be able to get on a computer and have that sort of thing. So we're hitting them from those sides. We're also trying to learn more. We have an extensive trust survey that's being disseminated now. We've had, I think, over 10,000 responses, and that'll help guide us. We've done focus groups, and so that'll help guide our efforts in the future, but also any future media that we pursue.
Okay, thank you, Thomas. From Anita Lee, and I think we touched on this a little bit, but we do get this question a lot. As state drive-throughs, why aren't second doses being able to get scheduled after the first dose is received? I think we touched on this. Jim Craig, why don't you go ahead and explain that?
Sure, and this is an area that will improve, and I hope that I get this improvement moving a lot faster soon. But this week was the first week that we introduced the Pfizer product in our drive-through locations as well. As you know, it has a little different logistical need in the ultra cold chain storage component that is required, as well as it's 21 days from shot to the second shot versus the Moderna at 28 days. So just making sure that we have the right products at the right locations for those second shots has been just a little bit more planning that we needed to do before those other appointments are made up, so that we can ensure that people have the shot they need at the right time at the right place.
Thank you, Jim. Okay, this, Dr. Byers, let's take a look at this together. When is the state going to release confirmed list of places where people can get vaccines? And when is the state going to release vaccination data by zip code? Okay, the first question, we did take off providers. We did have a list of providers on our website, and we took that off. It's a very fluid situation. Dr. Byers, can you try to explain that a little bit?
Yeah, I sure will. And so, as eligibility criteria have changed and we had a list up that were providing vaccines for one group, but we want to confirm that when we put a list up of a provider and we report their name out on the website, that in fact they are ready and prepared and have that vaccine and be able to administer it to those folks who are in those eligibility groups. And it is a very fluid situation. One of the things that we are continuing to work on with our partners is to make sure that we have not only provide that vaccine to our external providers, but also to have an understanding that when we do that vaccine and we provide it to them, that the expectation is that they will be providing it to those folks in those eligibility categories within their area. So we're working on that. We hope to have a list up very soon. We certainly recognize the importance of that because not everybody can get to one of our drive-through clinics easily. And we want to make sure that they have some awareness of where they can go to get additional vaccine. And so we're working on that now. And just had a meeting regarding that just before this conference. So I anticipate that that's going to be pretty soon that we'll have a list up.